Back now on Triad Today, and there are a lot of you who can identify with the two words I'm about to say, hip replacement. Yeah, you or a family member, a loved one, a friend, been through it. Let's learn more about hip replacement, shall we? We do it with a very special guest who's an expert in the field, Dr. William Refvem. He's an orthopedist with Northern Orthopaedics, appearing courtesy of the good folks at Northern Regional Hospital. Welcome to the show.
Thank you.
In general, how does someone know it's time to talk with you about a hip replacement? We'll get into specifics in a minute, but in general, how do I know it's time?
Well, any operation for a painful condition is dependent on, number one, how bad it hurts, and whether or not everything has been tried to avoid doing surgery, such as weight loss or activity modification, pills, that kind of thing. And when all that stuff doesn't work, then is when you consider having a hip replacement.
Come talk to you about it. All right, now you sent me an email about something called anterior approach. Now you're a little over my head, so I want you to explain a couple things. How is a direct anterior approach similar to a standard total hip replacement? I don't understand.
Total hip replacement has been done by orthopedic surgeons for, 50 years now. And it's traditionally been done from what we call a posterior approach. Every operation has a way to get down to where the business is. And the posterior approach is more on the backside in your buttock where the incision is made, and the approach to the hip is from the back side of the hip joint. The anterior approach is similar, and except you go in from the front, but all the same processes go into play. You put in the same kind of a hip implant, the same kind of rehab, that sort of thing. So it's only different in how we get to where we're going.
Would you say it's better, it's easier, better recovery time? I mean, what, put in the category of different. Help me with that.
It's different only in the sense that you go through less tissue to get down to the hip joint. I tell people it's kind of like if you're going to drive a car, you open the front door and get in the driver's seat. Well, you could open the back door and climb over the seat and sit in the driver's seat.
That's what I do.
Yeah, right. So that's the posterior approach. But the hip is actually an anterior structure. So if you go in from the front door, it's less to go through and easier to get in.
So then, and not to keep pressing the point, but if I go through this with anterior approach, am I going to feel better, get up, and do things quicker?
Well, yes and no. It's better, quicker recovery. It's still a bit painful, but there's less tissue damage. Every operation has what I refer to as collateral damage.
Right.
Damaged tissue getting in there, and you try to avoid as much of that as you can, but there's some you just have to do.
Right.
And you put stitches in and put it back together. With the anterior approach, there's less of that.
Okay.
Less damage, and it's a less painful thing. We get patients up that very day of the surgery to walk.
No kidding. Get up the same day to walk. Now, very quickly, what kind of patient, who should consider doing the anterior approach over the other?
Pretty much any patient with hip arthritis.
Any circumstance.
Almost any. It's good for everybody.
Now, obviously, we're not going to sit here and do a commercial and say that you're the best surgeon in the world, which you are. We're not going to do that. But just in general, seriously, who should people go to for this kind of procedure?
The anterior hip replacement is becoming, it's not this absolute standard, but it's more becoming the standard of care. I think that anybody interested in hip replacement needs to do a little homework and find out who and where. I mean, doctors all over the Triad are doing this procedure. And we at Northern Hospital are doing it on almost every hip that we do. And so just do the homework and find out who does it. And people who do hip replacements, almost all of them
and they know about it. Up on screen for more information, choosenorthern.org. Please check that out, choosenorthern.org. And I believe, and correct me if I'm wrong, 719-0011 goes to your
That's
office?
Right. That's
okay,
my
so
office.
they can check that out too. Doc, thanks for doing this.
You're welcome. Thank you.
All right. We'll be right back after this.